I'm Dr. Linda Snetselaar, professor in epidemiology at the University of Iowa. My research area is in nutrition epidemiology, and I'm also editor-in-chief of the Journal of the Academy of Nutrition and Dietetics. And I wanted today to give you some highlights of the February 2021 issue of the journal, which features a variety of papers, and in particular has several articles on the topic of diet and cancer. The first article is titled Evaluation of Diet Quality Among American Adult Cancer Survivors, Results from 2005-2016 National Health and Nutrition Examination Survey. And it is written by Dr. Lee and colleagues, where they explore diet quality as measured by the Healthy Eating Index 2015 and associated factors among adult cancer survivors. They report poor diet quality among American adult cancer survivors with significant disparities across socio-demographic and lifestyle factors, particularly education levels, body mass index, and smoking status. And then another article, once again, looking at cancer survivors, looks at self-reported changes and perceived barriers to healthy eating and physical activity among global breast cancer survivors. And this study includes an exploratory online novel survey. The author, Ms. Keever and colleagues, assesses changes in nutrition and physical activity behaviors after cancer diagnosis or treatment. These authors also look at barriers to eating a healthy diet and staying physically active, along with sources for seeking nutrition advice reported by breast cancer survivors. What they found in this particular study was that despite making positive changes in nutrition and physical activity behaviors after a cancer diagnosis or treatment, breast cancer survivors experience treatment-related barriers to eating a healthy diet and also staying physically active. Fatigue was the top barrier to making healthy food choices and staying physically active, and then other barriers in addition included stress, treatment-related changes that were very much associated with diet, things such as taste, loss of appetite, and craving unhealthy foods. And then in terms of physical activity, pain and discomfort tended to be a barrier. Of particular interest in this particular article is the idea that internet search was the primary source for seeking nutrition advice. Fewer than half of the study participants reported seeking nutrition advice from healthcare providers. And then in another interesting study done in the Netherlands, Dr. Skolpen and Vandenbrand examined sex-specific associations of Mediterranean diet adherence with overall cancer risk. So the title of this particular article is Adherence to the Mediterranean Diet and Overall Cancer Incidence. And this was done in a cohort study called the Netherlands Cohort Study, and it examined Mediterranean diet adherence, looking at overall cancer risk in male participants of this particular study, and then also looking at hazard ratios. They found while in males, there was really no association between adherence to the Mediterranean diet and cancer risk. In females, there was a pointed inverse direction. And this particular study also lost statistical significance after full adjustment for confounding in most cases. Another study involving, interestingly enough, chocolate candy looked at cancer risk in women. And the title of this article was Chocolate Candy and Incident Invasive Cancer Risk in the Women's Health Initiative. This was an observational prospective analysis. It was authored by Dr. James Greenberg and his colleagues. They were looking at the association of chocolate candy consumption with incident invasive total breast, colorectal, and lung cancers in a large cohort of postmenopausal American women. The investigators found that in this large study looking at women from the Women's Health Initiative, there was really no significant association between chocolate candy consumption and invasive total or breast cancer. There was a modest higher risk, about 18%, of invasive colorectal cancer for women who ate chocolate candy at least 1.5 times a week. And the authors indicate that these results still require confirmation. Then another study titled The Efficacy of Dietary Fiber in Managing Gastrointestinal Toxicity Symptoms in Patients with Gynecologic Cancers Undergoing Pelvic Radiotherapy looked at what effect diet from fiber sources might have on cancers, particularly the gynecologic types. And the author of this particular article, Dr. Crozier and her colleagues, summarizes the evidence of looking at nutrition interventions where dietary fiber is a focus, and then looking at persons who had gynecologic cancers and were undergoing pelvic radiotherapy to prevent or alleviate gastrointestinal side effects. And then these groups were compared with either standard care, placebo, or no intervention. The results from the systematic review suggest that supplementary fiber modification during radiation therapy may have some potential benefits with improving gastrointestinal symptoms. However, more definitive evidence and further exploration of fiber in a therapeutic role will be required to inform what needs to happen in dietary practice. And then finally, in another systematic review, taste function in adults undergoing cancer radiotherapy or chemotherapy, and then implications for nutrition management were studied. Doctors Nicole Kiss and her colleagues explore whether or not taste change is associated with cancer diagnosis or treatment modality in adults. And the key findings of this systematic review indicate that when compared with healthy adults, someone with a cancer diagnosis will not appear to have any kind of change in taste function. However, taste changes were consistently reported after commencement of radiotherapy, which occurred early and had long-lasting effects. Similar patterns of taste changes were also found in chemotherapy, although with chemotherapy there was less consistency in terms of the results. Some studies further reported reduced likelihood of food and appetite following cancer treatment. So what we need are additional studies in this area, but certainly very important data coming out of this study as well. These articles and more can be found in the February 2021 issue of JAND at www.jandonline.org.